My name is Anissa Mitchell. I'm with PMD Alliance, and you are joining us for our first live stream as part of our Proactive Brain Health Alliance programming. This focus today is titled, Am I at Risk for Parkinson's? So this program is a new initiative that we at PMD Alliance launched in partnership with C&D Life Sciences as a way to educate people and support them who are interested in a deeper understanding of the causes of neurodegenerative diseases and a way to pursue brain health through education, action, and community. So we may have people joining us that are just generally interested in knowing about all the things that they can do to maintain their brain health and reduce risk of neurodegenerative diseases. We may have people that may have been identified as at risk or even in a prodromal state, which we're going to be talking about today, and those who may have Parkinson's or family members that might be concerned about their risk. So we are going to be covering the whole gamut, but we created this particular alliance, which actually has its own website, and we are going to drop the link for that in the chat as an opportunity for us to have conversations and some education around those things that you might want to know as far as how to maintain brain health and things that you should know about what all that means. And so we're going to be diving into those. We know that with the advent of some of these really wonderful diagnostic tools, and research, that we have more opportunity to identify people earlier that might be at risk for future neurological diseases. So of course, this begs the question, well, what do I do now to increase my chances of staying healthy as I age? So that's why the Proactive Brain Health Alliance was created to offer that evidence-based education, support, and some kind of action steps you take. So we're going to be doing a monthly live stream that's going to be having different topics that will address some of the general brain health, but also those that might delve into specific things such as genetics and lifestyle changes. So we will be putting those up on our Proactive Brain Health website, as well as you'll see them on the PMD Alliance website for a period of time. And Kelly, I don't know if you already dropped that in the chat, but we will drop the link to our new website for the Proactive Brain Health Alliance a couple of times while we're talking today. So today's topic, the first one is on proactive brain health in terms of, am I at risk for Parkinson's? So we have a special speaker today. We have Dr. George Kannarkat. He is a trained physician scientist who completed a movement disorders fellowship at the University of Pennsylvania. And then after his fellowship, he stayed there as an instructor to continue seeing individuals with Parkinson's disease while concurrently working in the lab of Dr. Alice Chin Plotkin. His research interests are understanding the molecular mechanisms, particularly those outside the brain, that contribute to initiating pathology seen in Parkinson's disease. His ultimate goal is to develop technologies that identify and treat disease in early or prodromal stages. So if you don't know what prodromal is, we're going to be talking about that today. So I am going to hand this over to you, Dr. Kannarkat, and let you take over.
Great, thank you for that introduction. Very excited and happy to be here, and hopefully we'll be able to share some knowledge with all of you, and there'll be a lively discussion. So just bear with me while I share my screen.
And I did want to say one more thing. I forgot to say this, that we will take questions. So if you want to drop your questions in the chat, we will make sure that we address those. If you want to ask your question anonymously, feel free to just direct message me.
Great, thank you, Anissa. All right, so I'll jump right in. So today we was asked to speak a little bit about, am I at risk for Parkinson's disease? So we'll talk a little bit about what does that mean to be at risk for Parkinson's disease? And if you are worried about being at risk, what can you do to get more information? and or what can you do to maybe mitigate some of that risk or reduce some of that risk. So I always like to provide a little bit of context because I think context is important, and I think it's important for you to know who's giving you your information. So as Anissa said, I'm a physician scientist at the University of Pennsylvania, and I also see patients at the Veterans Affairs Hospital in Philadelphia. I was recently promoted to assistant professor, and so we'll be starting my own lab as well as seeing patients. And I got into this business, I think, in large part because my grandfather, who's pictured here, he was diagnosed with Parkinson's disease when I was in high school. And so seeing his journey, his struggle with Parkinson's disease really was a driving force for me to get into medicine, but also for me to work on Parkinson's disease. And it also prompted really this question of, why did my grandfather get Parkinson's disease? Could he have done something to prevent it? And what does it mean? What did it mean for the rest of the family, including myself? And as you can see down here, I have two kids, right? I worry, what is their risk for Parkinson's disease in addition to my own? And what are the things that we as a society and even as within my family, what can we be doing to reduce our risk of Parkinson's disease and other neurodegenerative conditions? And so I have multiple roles in my job, in my career. So I see patients, like I mentioned. I recruit people for clinical trials and do procedures for different clinical trials. And I also do my own research where I'm interested in how events outside of the brain, so things that people are exposed to in their daily lives, things like infections, inflammation. How do they lead to brain diseases like particularly Parkinson's disease, because that's the population I see in clinic, but also other diseases like Alzheimer's. Um, since we might have a little bit of a diverse group here in terms of familiarity with Parkinson's disease, I just wanted to give a brief background on what Parkinson's disease is. So Parkinson's disease is a disease of aging. So the number one risk factor is getting older, which we all inevitably will do. The main symptoms of Parkinson's disease are slowness, meaning people with Parkinson's disease walk more slowly, they move their arm more slowly, and it tends to start more on one side than the other. And then other symptoms that can occur, but not in everyone, are things like tremor, and so particularly a tremor when you're not using your hand. Stiffness, which is both subjective, people feel that they're more stiff on one side of the body initially versus the other, as well as when a doctor examines you, it is harder to move your arm when it's at rest. And then postural instability, meaning your brain doesn't send the right signals to the rest of the body to maintain an upright posture. And so you're at risk of suddenly falling or losing your balance. And to this day, Parkinson's disease is made by a clinical diagnosis. So when someone comes and sees me, I can make a diagnosis based on someone's history as well as their physical exam and what they look like in the office in front of me. But there are a few things that can be helpful, and I'll talk specifically just about one right here because it's been the most longstanding, is the DAT scan. And so the DAT scan is a scan that looks at how dopamine is handled in the brain. Dopamine is a chemical in the brain that is responsible for many things, but one of these things is movement. And so loss of dopamine production in certain areas of the brain leads to the symptoms that we see in Parkinson's disease. You see here the bright red and white areas are where dopamine is going in the brain. And you see in a normal scan, it's kind of these comma-shaped areas here. And you see in someone in Parkinson's disease, that comma shape is lost, meaning that dopamine is not getting to the right place. So sometimes the DAT scan can help us in our diagnosis of Parkinson's disease in the right context. But I show this here to show also that this is really our understanding of why the symptoms, at least the movement symptoms, occur in this. It's due to the loss of dopamine production in this part of the brain. And then the other thing that we know about in most people with Parkinson's disease, we think that these brain cells that are producing dopamine are dying because of the accumulation of this protein in these cells called alpha-synuclein. So alpha-synuclein normally is expressed or is present at the place where brain cells talk to each other. It's also present in lots of other parts of the body. Um, but what happens in the brain in people with Parkinson's disease is that the alpha-synuclein starts to clump together, and we think that that causes the brain cells to not work properly, and then the brain cells ultimately die. And you can see this in these areas that are in brown here, this and this area that's in red here. That's the accumulation of alpha-synuclein within brain cells. So that's a kind of a very quick overview of Parkinson's disease. Um, and then next, I just want to talk about why do people develop Parkinson's disease? Because to understand whether you're at risk, we have to understand why do people develop Parkinson's disease? Like I mentioned, it's a disease of aging, and we understand that there's probably a contribution of genetics as well as a contribution of environmental factors. Um, the genetics, so what genetics means is the genetic code is in all of your cells throughout your body. It tells your cells what to do from the very beginning as a human embryo. It has all the instructions for that. You can kind of think of it as a recipe. So I kind of think about your genes, your genetics as the recipe for your life, right? For how you're formed, how your body's put together, how your brain is put together. But even if you have all the same ingredients and you're following the same recipe, things can happen along the way as you're putting the recipe together. So if you're using a slightly different grade of flour, it's not sifted properly, it's more humid, it's your oven doesn't get to quite the right temperature it should, right? All of those things end up changing the output of the recipe, right? It's not the same kind of cake as someone else might have made with the same recipe. And that's how I think about how genetics interacts with the environment. So your body comes with all of these sets of instructions, and some people might have a set of instructions where you're more likely to get Parkinson's disease, whereas other people might have a set of instructions that you're less likely to develop Parkinson's disease. But it's all of these other environmental factors that you're exposed to over your lifetime that play in with this recipe or your genetics to ultimately determine are you developing Parkinson's disease or not. Um, and we think genetics is probably directly relevant for 15% or less of people that develop Parkinson's disease. And what I mean by that is you have a genetic change. It's probably it's very difficult or maybe impossible for you to really do anything to prevent you getting Parkinson's disease. Maybe there's things you can do to delay Parkinson's disease, but it's very difficult to say that you wouldn't get Parkinson's disease. And when do we get suspicious that this is in play? So if anyone has a first degree relative with Parkinson's disease, and that means a parent, a sibling, and especially if there's more than one person that has that's a first degree relative that has Parkinson's disease, we get really concerned that there may be a genetic component. And then people that have young onset Parkinson's disease, so less than 50 years old. And when we start getting below the 50-year-old group where the symptoms started before they were 50 years old, this percentage of genetic cases that starts to increase above 15%. And then there are also specific ethnic groups that we know have these genetic changes that are overrepresented compared to the average population. And so these groups are classically ones like Ashkenazi Jewish population, the North African Berber population, where specific genetic variants are more common. And so if you have any combination of these, the doctor that's seeing you and diagnosed you with Parkinson's disease may recommend genetic testing for that individual. And if that genetic testing shows something in that individual that has Parkinson's disease, there may be a larger discussion about testing other individuals to figure out whether they may be at risk for Parkinson's disease, particularly in the case of children. People often want to know, is this something that my children have to worry about in the future? Or siblings, particularly if their siblings are, around the same age or younger, are they also at risk for Parkinson's disease? And it makes sense for planning for the future and things like that. And then I'll talk a little bit about what are the things we know of that play into this risk from the environment, so environmental risk factors. So we have identified in population studies things like traumatic brain injury. What I mean by that, right, are things like even as minor as concussions, versus going to the hospital for a brain bleed, bleeding in the brain after having a car accident. So that's what I mean by traumatic brain injury. And then toxicants, meaning pesticides. So I think some of the most famous pesticides are ones that have been used in agriculture and have essentially now been phased out because they have other toxicities as well as causing Parkinson's disease, as promoting Parkinson's disease. And these include things like rotenone and paraquat. But there are many others that have been associated with Parkinson's disease that are still in use today. And then there are chemical solvents. I think the most famous one, and probably the one that's been in the news most recently, has been trichloroethylene. And trichloroethylene is used as an agent in dry cleaning solvents. It Dry cleaning solvents. It's also used in other industrial cleaning mechanisms. And then I think another kind of more famous case recently has been its identification or its association with U.S. military veterans that were stationed at Camp Lejeune in North Carolina. The water there was actually contaminated with more than safe levels of trichloroethylene. And then there are other heavy metals, particularly manganese, lead. So people that work in welding are exposed to fine particulates during their time in their job. Those individuals are also at increased risk of developing Parkinson's disease. And then now there are some studies showing that actually elevated levels of air pollution also are associated with increased risk of Parkinson's disease. So there are all these kinds of things that are everywhere that may increase your risk of Parkinson's disease. But I think we can talk a little bit about that later. Maybe what are the ways in which we can mitigate that risk, and even as a society, how should we be thinking about some of these exposures? So to talk about risk of Parkinson's disease, we have to understand how do we think about when people develop Parkinson's disease? How do we classify people? So as I mentioned, we diagnose people when they develop the symptoms of Parkinson's disease and show up in our clinic. And these are things like slowness of movement, stiffness, tremor, which we discussed a little bit earlier. And so this is when people get diagnosed, probably, if you're lucky within a year of these symptoms developing, but more often a little bit later than that, by the time they end up in a Parkinson's disease specialist clinic. Um, and there are certain symptoms that we know that can occur up to years before people develop the movement symptoms of Parkinson's disease. And on this graph here, right, it shows even up to 20 years before, so decades before. So symptoms like constipation, hyposmia, which is loss of sense of smell, excessive daytime sleepiness, depression, anxiety, and a lot of those, unfortunately, can be kind of non-specific, meaning they can be caused by a lot of things. But probably the most specific symptom is called REM behavior disorder. And so we'll come back to what REM behavior disorder is in just a second. But what we consider when we say prodromal, meaning these are a group of symptoms or a phase where people are at a risk of developing clinical Parkinson's disease, but haven't developed those clinical symptoms yet. So that's prodromal. And I think now people are also kind of talking about a term preclinical. I think that's a little bit more vague because preclinical means that you actually don't have any symptoms at all of Parkinson's disease. And so now I think there's more of a push towards people including this group here as prodromal, and maybe defining even people before they develop any of these prodromal symptoms as preclinical. So there's kind of an ongoing discussion among doctors and researchers about how we can how to best define Parkinson's disease. But I think the most defined definitions right now are the prodromal phase, where people have these different symptoms, and then once they're diagnosed, they have clinical Parkinson's disease. All right, so now we'll go back to REM behavior disorder. So what is REM behavior disorder? So normally, when we're sleeping, our brain goes through different phases of sleep. So we started in kind of a light phase of sleep we call stage 1, all the way to a deep phase of sleep called stage 3. And those are all what we call non-REM. And what REM means is rapid eye movement, and that's what REM stands for. So those stage 1 to 3 are non-REM. And then we go into a stage called REM sleep, or rapid eye movement sleep. And why it's called rapid eye movement, because if you were to lift someone's eyelids while they were in rapid eye movement sleep, you would see their eyes go back and forth like this. But other than that movement, normally we're completely paralyzed during that phase of sleep, during REM sleep, except of course for our breathing muscles. But people with REM behavior disorder, their brain does not completely paralyze the rest of their body, so they can act out their dreams in their sleep. And often people will say, "Oh, well, they themselves won't be aware of them acting out their dreams, but the person that shares the bed with them will say, well, they'll kind of yell out or move, or sometimes they get punched or kicked while the person is dreaming." Then I will wake them up and they'll have no recollection really of what has been going on. Maybe they kind of vaguely remember the dream, but they won't remember that they were actually moving during the dream. And in general, it's not dangerous for them to be acting out their dreams. Sometimes people can be so violent they fall out of bed, but in general, it's not dangerous. But we've now recognized that people that have RBD are at a very high risk of developing Parkinson's disease at some point in their lifetime. And some studies have shown that even up to 90% of people that have RBD will develop Parkinson's disease or some other related neurodegenerative condition during the course of their lifetime. And we'll kind of talk a little bit. We can talk a little bit more about that and strategies to mitigate that risk. But first, we'll just talk a little bit about brain health, right? So we're just now kind of realizing and studying this population of people that are at risk for Parkinson's disease. And now we have some tests that I'm sure we can talk about. You may have questions about, but now that we have this group of people that were at risk for Parkinson's disease and other brain conditions, so particularly Alzheimer's disease, other kinds of dementia, what are the things that we can do about it? What are the things that we can do to promote brain health? I think if you're able to do anything, physical exercise has some of the strongest evidence for being both protective against Parkinson's disease, but also other types of neurodegenerative diseases, including dementia. And what I mean by physical exercise is all kinds of exercise, but particularly aerobic exercise, anything that gets your heart rate up. That can include swimming, biking, running, walking, calisthenics, Zumba, things like that. So anything that will get your heart rate up. And particularly if you're able to exercise, longitudinally, meaning throughout your lifetime, that is the thing that provides the most amount of protection. And even if you're not an exerciser now, it's never too late to start. People are often, concerned about, okay, but I don't like to do this kind of exercise. I don't like to do a specific, I can't run outside. I can only go on the elliptical, and that's fine, right? Do the exercise that you're going to do. Because, if you're going to try to do something you really hate doing, you're just not going to do it regularly. And it's just important to do the kind of exercise that you're actually going to do on a regular basis. The official recommendation from the American Academy of Neurology is that people do 30 minutes of exercise a day, at least 5 days out of the week. But I tell the people that I treat, do as much exercise as you can, right? I don't think unless you're doing exercise where you're going to hurt yourself because of, and cause trauma to yourself, I don't think there's a thing as too much exercise, right? So that means taking the stairs when you go to and from a place, if you're going to an appointment, try to take the stairs if you can, walking as much as possible throughout your day. So I think even those kinds of simple things that increase your physical activity are really important to think about. Um, Next is sleep, so regular sleep. So we know that particularly for dementia, that the lack of regular sleep increases your risk of dementia. Um, we are not exactly sure why, and it's kind of funny. We all sleep, but I think there's not a clear answer on necessarily why, why we all need to sleep. We know that it is bad if you don't sleep, right? You get moody, irritable. You can't think as clearly. You have poor decision making. And there's these, I think, all kinds of hypotheses and some evidence to support these hypotheses that the brain starts to make and kind of make and solidify new stronger connections with different circuits, consolidate memory when you sleep. There's now some evidence that actually the brain's kind of garbage cleaning system, if you will, is most active while you sleep. The spinal fluid that has accumulated this kind of, for lack of a better term, garbage over the course of the day, all of that gets cleaned up while we're sleeping. And so you can imagine, right, for all of those reasons, getting regular sleep is really important. And so, if you're able to get regular sleep and kind of optimize all of the things that are going to allow you to have regular sleep, that's I think really important. I think some of the most common things that I see or hear about in my clinic regarding sleep are just kind of bad habits like falling asleep watching TV, being on your phone right before you sleep, not going to bed in a regular time, um, and then also being in a quiet place, in a relatively like cool, comfortable space if you can be, and then also treating other medical conditions if you're really not able to get good sleep. So things like heart problems, sleep apnea, they all disrupt your ability to sleep properly. Next is, I think, healthy diet and health. For the sake of time, we'll just kind of talk about healthy diet and healthy weight at the same time. And I think healthy diet and healthy weight can mean different things for different people. And specifically for Parkinson's disease, there hasn't been evidence that one specific type of diet is best for people with Parkinson's disease or even preventing Parkinson's disease. But we do know that for brain health, that being overweight and eating high processed foods, high calorie diets are not good for your brain. And so I think being on any diet, I think is helpful because you kind of pay attention to what you're eating and the things that you're putting in your body. Because if you're not on a diet and you're not kind of watching how many calories you eat, what are the kinds of foods you eat, you're not necessarily paying attention to what are the things that are going into your body. And I think that's why being on a diet is so important, whether it's um, uh, being a vegetarian, eating with intermittent fasting, like irregular fasting intervals, things like that. If there is a diet that you do want to follow, I think the Mediterranean diet has been very well studied. It's been studied specifically in individuals with Parkinson's disease. And I certainly think it's something that is doable without too much effort in our American society. Um, so then the other two things that are protected for brain health are ongoing social engagement and mental activity. And what I mean by social engagement are, so I'm a scientist, so I like to talk about data. So what are the things um, that are supported by data? So people that are part of communities live longer and have better brain health. So that can mean going to church. That can mean being a part of a social club. That can mean regularly going to dancing events. So we as humans are social animals, right? Our brain thrives on this connection to other people. And so that means meeting people, talking to people, and I think part of brain health is, right, navigating some of these social interactions, right? It keeps our brain active, it keeps our brain healthy. Um, and that kind of ties into things like mental activity, right? People always ask me, okay, what if I download this app on my phone and I do these puzzles? Does that help? Is that helping my brain? Is it keeping my brain healthy? There's not really any of these kind of apps that have definitively shown that they, in the long term, help reduce the risk of dementia or Parkinson's disease. However, I think there's a balance, right? I think certainly there is it's probably it's good for your brain to solve puzzles and things like that. But if you're on your phone and you're not interacting with other people or your environment, right, I think that's detrimental. So I think there's a balance. If you're doing puzzles with other people, or you're playing a board game like chess, for example, right? It's kind of a puzzle, but it's more interactive. I think it's the best of both worlds. So I think just kind of thinking about the things that you're doing for your activity, your sleep, your diet, how are you interacting with other people in your life? Those are the things that I think are helpful to think about, and thinking about how can you build your life to promote your brain health, and ultimately reduce the risk of not only Parkinson's disease, but other brain diseases. But I will stop there for now, and I will open it up to questions. And I have, some other slides if questions are asked to kind of touch on those topics.
Okay. We do. And I'm going to go back to some of the earlier stuff that you were discussing in regards to genetics. So, the first question would be for those who are concerned about whether they might have a genetic risk for Parkinson's, such as they have those criteria there, first degree relative, young onset, particular ethnic groups. Is there a particular test it's best for them to use?
Yeah, so that's a great question. So I think the answer to that is it depends on the best test depends on what the situation is, what the context is. So first, it depends on, the person that has Parkinson's disease. Are there specific features of that person's Parkinson's disease that give us clues as to what could be, what the genetic change could be? And then second, it also depends on the family history, whether it's young onset or it's just which of these three particular risk factors are involved. But ultimately, there are some screening, there are some screening tests, particularly for people that have Parkinson's disease, that are readily available. So PD Generation is a study funded by the Parkinson's Foundation, that has its goal has been to basically do genetic testing on as many people with Parkinson's disease as possible. And this has been to identify and also to identify new genetic changes that are associated with Parkinson's disease. And so they test about somewhere between 7 and 10 genetic changes that are associated with Parkinson's disease. And there are clinical tests that your physician themselves can also order, that are generally covered by insurance if you fall into one of these categories, that are kind of standard genetic testing. Again, they test the most common causes of genetic Parkinson's disease. But if you've kind of passed those two first screening kinds of those most common causes of genetic Parkinson's disease, it may be helpful, and even in the beginning, to see a genetic counselor, because they can also advise on other testing, particularly if your family history is really strong, or you have young onset and you want to make sure we're not missing any kind of rarer genetic changes that could have contributed to the Parkinson's disease. And I think if you're someone that is a family member of someone that has Parkinson's disease, but has some of these features, I think the important thing is if you're able to get the person with Parkinson's disease tested first, because that will make the testing for everyone else in the family much more simple. We just have to look for that specific genetic change that the person with Parkinson's disease has, rather than kind of repeating all of that testing for everyone else. And it's unfortunate, but we live in a world, right, where some of these tests are not free, and insurance will only cover certain tests. So We want to do things as efficiently and cost effectively as possible. And so that's where seeing a genetics counselor can be really, really helpful. And they sometimes even have these connections to some of these companies that will do the testing and can find ways to do the testing quickly and cost effectively for you.
Okay, so related to that, we just got a question. If someone already has RBD, is there potential to benefit from genetic testing? And if so, why?
Yeah, so I think if you have RBD and I think the only reason that I would consider getting genetic testing is if you fell into, again, one of these categories here on the slide. So if you have a first degree relative that has Parkinson's disease, or you're of a particular ethnic group where we know that there are increased risk of having one of these genetic variants. And the reason that you would want to get tested is because some of the clinical trials that are now out there, I think in the next, so in the definitely in the next couple of years, and even now, are recruiting people with Parkinson's disease and soon people with RBD that may have some of these genetic variants. And the reason that that's important is because some of the drugs that are being tested in these clinical trials are specifically working through working on some of the genetic changes. So LRRK2, GBA variant carriers. There are clinical trials that are targeted specifically for those sets of individuals. So if that would be something you're a clinical trial they'd be interested in participating in, knowing your genetic status could be helpful. But I think again, it would only be really, I think really this, I would recommend testing only if you're part of these specific groups, because
And,
otherwise, I think your chance of finding something is equivalent to the general population.
and since you mentioned those two specific genes, um, is there different symptoms that correlate with the different genes?
Yeah. So I think this is a great time to maybe talk about this slide, and then I'll kind of talk about different symptoms. So um, so not all genetic changes come in the same uh, fall in the same category. They can have different types of effects. So you'll see here that the variants in listed on the slide are kind of grouped into three big ones, right? So the ones that have a large effect, the ones that have a medium effect, and then the ones that have a small effect. And as you can guess, right, the ones that have a large effect are pretty rare, meaning that they're not commonly found in across the human population. And that makes sense, right? Because otherwise, if they were common, the proportion of people that have Parkinson's disease would be really high. But these group of genetic changes, they do differ from one another a little bit, but in general, people with these genetic changes will have a earlier onset of disease, meaning that they'll be younger when they start having Parkinson's symptoms. The disease can be more aggressive, and they can also be more likely to have trouble with thinking and memory if you have some of these specific genetic changes. Um, then I'll talk about this other group here, what we call the common genetic variants. These have a smaller effect. And these are all genetic variants where it's pretty, like a large percentage of the population will have it. Maybe even up to like 40% of the population may have this specific genetic variant that's associated with increased risk of Parkinson's disease. But the risk is increased by a really, really small amount. And a lot of times we don't understand how that genetic change directly relates to that increased risk of Parkinson's disease. Um, and then there's this medium group here where, for example, people with some of the LRRK2 mutations or genetic variants, not all, not, and also this is also true for GBA. So they are not guaranteed to develop Parkinson's disease over their lifetime. The risk is certainly increased. So, for example, people with LRRK2, depending on which study you look at, It can vary from as low as 30% of people with a specific genetic change to as high as 70% will develop Parkinson's disease over their lifetime. So again, even if you have the variant, it's not guaranteed. For GBA, it can range from as low as I think about 5% to about 30 or 40%, depending on which genetic variant in GBA you're talking about. So again, this goes back to the idea of the recipe may be the same, but there's still a lot of things that go on in terms of making, executing that recipe that can change whether you get disease in the first place. And I just throw this example on here because this is just looking at GBA itself. So you can see there's a number of different variants that have been associated with different diseases. So the GBA gene was actually first associated with Gaucher's disease, which is a problem with it causes the problem with the trash disposal system of your cell. And those people can have problems from really young in terms of not just brain-related problems, but also immune-related problems. But other variants in GBA can also cause Parkinson's disease, and it can cause just REM behavior disorder without necessarily developing into Parkinson's disease. It can cause a type of Parkinson's disease that starts primarily with dementia or thinking and memory problems, what that we call dementia with Lewy bodies. So yes, the type of variant does matter in terms of what your symptoms may be and how fast things progress. So knowing whether you have a genetic variant and which kind can be informative. And I think now we're on the edge of being able to do things about it because we're recruiting people with specific genetic changes into clinical trials. And so hopefully some of those medicines that we're testing will be helpful for those groups of people.
So we had a question earlier that I think would relate to what you were just saying. So this person wanted to know, is there a segment of the RBD cohort who will not phenoconvert to PD for whatever reason? I know earlier you said 90%, I think it was, and this one you said there might be ones that might not. So can you speak to that?
Yeah, absolutely. So I think we're still trying to completely understand the answer to that question, and that's because we need more data. We need more people to we need to kind of understand this more and follow more people that have RBD. But we do know that there certainly are people that have RBD that never develop Parkinson's disease or anything related to Parkinson's disease. So it's definitely not 100%. Um, it's not guaranteed that you will develop Parkinson's disease, but um, we don't understand. For any given person, we cannot predict when or if. And that's why there's a range, right? Some studies, it may be like 20% is what's reported, and other studies, again, I think the highest I've seen in the literature is 90%. But it depends on how long they kind of were able to observe people. And, it also depends on, again, your genetic background as well as your environmental exposure over time.
And I know we're running out of time, but that does it leads me to ask this last question related to genetics and environmental exposure to toxins is there a difference or a risk difference of someone who has a genetic risk and exposed to toxins compared to someone who is just exposed to toxins?
So we do know that having a specific genetic risk and being exposed to specific toxins does increase your risk of developing Parkinson's disease. There are population studies that have looked at that. And so that's why I think being able to mitigate some of your risk by paying attention to the things you do, the things you're exposed to as much as you can be is really important. And again, from a societal perspective, right? I think there's so much that I think doctors and researchers can say, right? But the public, people like you think that are on this call, thinking about, okay, maybe some of these things that are commonly used as solvents in various industries are these things that really we should be using. Maybe we should think about how to either use them more safely or use alternatives that we know are safer. Um,
So I want to talk a little bit about some of the prodromal at-risk uh, things. And one of the questions that came in earlier was, you are aware of the PPMI research that has suggested that the alpha-synuclein assay may be an early biomarker for PD, even before UPDRS scores reveal PD. What are your views on this finding?
I'm very well aware of that, and just so that everyone is aware of what we're talking about. So there are tests that at least identify abnormal alpha-synuclein, which is that protein that clumps together and causes problems in brain cells. There are tests that can test for that, and we can show that in a high percentage of people that have specific symptoms like REM behavior disorder or loss of sense of smell, that a large percentage of those people are positive for or have this abnormal alpha-synuclein. One of these tests is a spinal fluid test, and that's the one that I think the question is the one that the question is referring to. This is what's used by the PPMI study. The PPMI study is a Parkinson's progressive marker initiative. Is a study that's been looking at identifying new biomarkers for Parkinson's disease, and so this finding actually came out of that study. So this is a test that uses a sample of spinal fluid, which is done by a spinal tap or a lumbar puncture, and I do this procedure all the time for patients. Actually, have done it for the PPMI study, where we put in a needle in the lower back after anesthetizing you locally, just like at the dentist's office. Put it in, collect some fluid, and send it to a lab where they test for this presence of this abnormal alpha-synuclein protein. The procedure itself in the office to collect the spinal fluid typically takes 20 minutes or less. And what the test is actually doing is it takes that spinal fluid, puts it in with normal alpha-synuclein protein, and shakes it up for several hours. And what we see is as the synuclein clumps together, as it would in brain cells, we see a fluorescent signal, gives off a light signal that we're able to detect on a machine. And so that's the test that we're talking about. And then just briefly, there's also a skin test. Again, this has been also shown that in certain populations, like people that have REM behavior disorder, people have abnormal synuclein in their skin. And so it's a skin biopsy, just like at the dermatologist's office, and we look for abnormal synuclein under the skin. So we know that this presence of abnormal alpha-synuclein is highly, highly associated with Parkinson's disease. And so I think we're just scratching the surface on whether, on understanding how, what does it mean if if you're prodromal, you have RBD or loss of sense of smell, you have a positive skin test or you have a positive spinal fluid test. We're trying to understand what exactly that means for your individual risk. There are some small studies showing that if you have your prodromal and have this test, that you're more likely to develop Parkinson's disease, and it's probably going to happen sooner than someone that doesn't have a positive synuclein test. But again, that's on a population level. It's not on an individual level. So we're still, I don't routinely recommend people with RBD getting this test because I don't think it's necessarily going to change what it does for you on an individual basis. I think it still tells you the same information that you are at risk for Parkinson's disease, but it still doesn't tell you for sure whether you're going to get it and doesn't tell you when you're going to get it. So I think all it does is maybe increase your anxiety if the test comes back showing abnormal alpha-synuclein at this point. But I think it's an important way for us to start to understand that, and maybe in the future, hopefully in a few years, we'll have a better understanding of what it means. And then in terms of kind of understanding how we think about the disease, I'll just kind of jump to this, right? We are now there are people in the field that are proposing a different classification system for Parkinson's disease. So not only based on presence of symptoms, so this is now what we call stage 2 and beyond, would be people that have clinical Parkinson's disease. And then kind of what we call the prodrome is before stage 2. And so defining Parkinson's disease as including that prodrome is what we're now trying to do based on these markers of alpha-synuclein. And there are some people that have an abnormal DAT scan. Remember that scan that looks at dopamine? That scan can become abnormal even before you have clinical signs and symptoms of Parkinson's disease. And so that would be someone that is prodromal um, for Parkinson's disease. Um, and then I think I'll stop there for now, and we'll kind of if anyone has any other
Well,
questions.
and I think you just asked the question that came in about whether that synucleinopathy means that they have a neurodegenerative, that's a word,
Yeah,
full word, neurodegenerative disease or present already, or they will develop. So I think you thoroughly answered that. So thank you. So talking about some of the prodromal symptoms, in regards to constipation, we know that is one. Is there a definition of how many bowel movements a person would have or lack to meet the criteria for at risk or meeting that prodromal definition?
Yeah, so there is a definition of constipation that's pretty uniformly used across studies. And so that involves, so either you have less than 3 stools a week, or more than 50% of your stools are you have to strain to pass them, or they're very, very hard and solid. So that's kind of that's the definition though of constipation, and that's been adopted in the Parkinson's disease field as our way to define constipation. But again, constipation on its own is such a non-specific symptom, meaning that there can be lots of things that cause constipation. So it's difficult, it's difficult to say that just because you have had constipation for a long time, it's that's not necessarily an easy population for us to study to understand the risk of Parkinson's disease because it's so non-specific.
I'm just curious because we talked a little bit about lifestyle, diet. We hear a lot of talk about the gut biome and the brain gut axis and all of that. Does addressing the gut biome reduce the risk of development if someone recognizes that they might have a risk for development of a neurodegenerative disease if they take action to improve their gut health? Is there any correlation to that?
Yeah, so we certainly know that the gut biome of people with Parkinson's disease is different from health people without Parkinson's disease of the same age. There are some studies showing that people that are at prodromal Parkinson's disease, they also their gut biome is different. And this also makes sense because we actually can sometimes see the abnormal alpha-synuclein in people's gut even before they have developed clinical Parkinson's disease. So we know that there is something different. I think the difficulty I have is always, is it it's a chicken or the egg problem, right? Did the gut microbiome change because of the abnormal alpha-synuclein? Or is the alpha-synuclein there because of the difference in the gut microbiome? I think it's a little bit too early to say one way or the other. And I think it's also, it's difficult for us clinically to change our gut microbiome. There's good evidence actually that the gut microbiome is set actually pretty early on in our life, and at that point, it's actually hard to change kind of the overall composition of our gut microbiome ourselves, unless something kind of like dramatic really happens. You develop some sort of inflammatory disease, you develop Parkinson's disease, you take a lot of antibiotics, right? So there are ways to change it, but it's not easy. But I think the thing to keep in mind, right, is that if you're eating a balanced diet, you are watching what you put into your body, you have a better sense of what are the things that are healthy for your microbiome. And I think a lot of the things that are going to promote good gut health are going to be healthy, promote a healthy microbiome. So again, things that are high in fiber, those are things that you're not going to get in a processed food diet. So being careful about what you put into your body, eating fresh fruits and vegetables. If you want to take a probiotic, I think that's fine. But again, there's no evidence that one single probiotic is going to prevent any kind of neurodegenerative disease. So I think it's watching overall what are the things that you're eating on a daily basis and putting into your body. That's going to be the key to promoting gut health.
And another question related to diet is fasting recommended or discouraged to prevent or delay the onset of clinical signs of Parkinson's?
Yeah, so fasting itself has not been well studied specifically to Parkinson's disease. There are studies that show that, so I think now some of the more recent studies have shown that actually it's more about just overall caloric intake, whether it's done by consistent intermittent fasting, meaning you're only eating for 6 hours a day, the rest of the time you're fasting, and that's what you do basically every day of the week, or 5 out of 7 days of the week. Versus, right, there are people, there are cultures where fasting is normal. Like you'll fast on a Sunday, you'll fast the entire day. And then there's also other kinds of diets where you have a calorie limit, right? You say, I'm only going to eat 1,500 calories this every day, and you just restrict your calorie intake. And so there are some studies that have come out now showing that actually all of those are equivalent. It just really depends on your overall caloric intake on an average basis. So I think fasting is fine if that's a way for you to be able to restrict your caloric intake. But I think all of that essentially translates again into watching the things you eat, maintaining a healthy weight, and that's what fasting is doing for people. I think that's my take on what the overall evidence shows. And keeping a healthy weight, having good cardiovascular health, eating a healthy diet, all those things translate into better overall body health, which also translates into overall brain health.
Awesome. Well, I want to thank you so much for this conversation. It's been really helpful. You've answered a lot of good questions, so I appreciate that and appreciate those who submitted their questions. This will be recorded. As you see, it's being recorded. It's going to be put up on our new Proactive Brain Health Alliance website. So we'll drop that in the chat. We actually have another program coming up in October, or no, September, I guess is the next month, that is going to be addressing lifestyle medicine. So we're probably going to delve into some of the things that we covered today a little bit deeper in terms of exercise and nutrition and sleep. And so all of those things around that. So I see Kelly dropped a link for that chat. You can also find that on the Proactive Brain Health Alliance website. Again, this is our new Proactive Brain Health Alliance programming that we have created in partnership with C&D Life Sciences so that we can start helping people address their brain health from the very beginning and be proactive about that. So I appreciate Dr. Kannarkat for coming here today and just giving us such a nice overview of what all these things mean